I must make a comment. A grant investor.
Yeah.
That's not even an investor for me, but
Yeah.
it's a grant provider.
Yeah.
Forcing you as a CEO
Yeah.
to come back from maternity leave
Yeah.
because the person felt the company couldn't run without you.
Yep. Yep.
Wow. Okay, let's talk about the positive one then. Hi everybody, welcome to Talk Tales of an African CEO. So today we're in Nairobi, Kenya, with a good friend of ours, Norah. She'll tell us everything about herself and her journey building Dropaccess and many other things on the continent. So welcome to Talk, Norah. Let's start with something. How did we meet? Do you remember?
I think we met through the Royal Academy of Engineering because I applied to be one of the Africa Prize fellows. I think that was 2021, 2022 cycle. And you were actually one of my mentors. That was the first time ever to meet you. So I knew you through the Africa Prize as a mentor, as a business mentor who had experience in the African landscape, fundraising, but also building a sustainable business.
Funny enough, I'll tell you a story about that. So I had joined 2020, 2021. Guess what? Those 2 years, I was elected the best business coach 2 years in a row. So it was really interesting to me. I was really, really motivated. I really enjoyed the time with them. And then we met after that.
Yeah.
Yes.
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 After the Africa Prize, I think we met through other networks like the Gender Network. And
Absolutely.
also pretty much seeing you build Jesuit. And also maybe you doing a landscape analysis, talking to entrepreneurs, and I'm one of the entrepreneurs that you spoke to.
Yeah.
But we built a friendship beyond that.
Absolutely.
That just surpassed so much.
Absolutely. So tell us, who are you? Where you come from? And what led you to build Dropaccess?
Yeah, sure, definitely. So my name is Nora and I used to identify as an engineer first.
Nice.
But, but I think nowadays I've become a lot of things. I am an entrepreneur, I am a mother, I am an African champion for African-based technologies. So I think I'm more of those than engineering just adds to all that. And Dropaccess initially started as an NGO because I was living in a rural community and faced energy challenges, and I also served the community. And I thought we should do this as an NGO, like get funding, donate solar lamps. That's originally just the starting point of it all. But I think being in the NGO space and seeing how the NGO space is transforming in Kenya and seeing the push towards much more sustainable business model made us do a pivot at some point in 2021 to do a limited company. And I can tell you, Steve, the trajectory changed so hard and so fast. And I got into a wave of learning how to build a sustainable business model, but still also creating impact. So the right now Dropaccess, in a nutshell, builds and develops technologies with our flagship product, being coaching technologies for the healthcare sector. That is Vaccibox, a portable solar healthcare refrigerator.
Excellent.
So
Can I stop you for a minute?
yeah,
You're
sure.
going way too fast.
Yes. Oh my god.
So look, I really want to understand the maybe one event or one observation that you saw in the community that really triggered the Nora, I must do something about it.
Yeah, definitely. So before when I talk about that, I want to give you a bit of a backstory.
Sure.
So before I moved to live in Makueni County in Kenya, I used to work as an intern, and I got now become like a technical officer in a solar company that was doing solar mini grids for flower farms. And we're building structures and doing energy audit to develop solar technology for flower farms.
Out of curiosity, which company was this?
It was called African Solar Design.
Okay.
It was closed. Right now, it's not in operation.
Oh.
And there's a bit of a spin off into something else.
Oh.
So I was really deeply involved in developing microgrids for for flower farms and also just large corporate organizations. But the thing is, the statistics of what energy poverty wasn't really telling about flower farms. Flower farms are rich entities that could afford to buy it, but the funding was going to them to test out like can they actually pay for it. Well, fair enough, solar is much more expensive then. But then to me, I thought, okay, fine. So there's this new revolutionary technology that has come in the market. It's mostly fitted for rural communities. So why are we doing flower farms? Anyway, it wasn't. My job was to do popular health, so I focused on that by doing lots of research for rural communities. But when I moved to live in a rural community, the reality really hit home. I totally understand the two sides of the coin. So there is the ones who can afford it and they can be financed for it. Then there are those who can completely afford. That's the rural community and the community I was living in, and myself facing blackouts often and challenges even getting my own child vaccinated because there is no electricity. So that really just triggered the engineering aspect of how do we make this solar work for rural community? How do we make these technologies affordable? How do we think of other financing models that just ensure that there is light for people in their homes and they are getting technology that just makes sense. But there's a twist to that. It wasn't that clear cut and easy. I eventually found out that even the communities in the rural, in Makweni, who eventually got a solar lamp, whether it was for myself or somebody else, but still serving under the solar lamps. So to me, I thought of then let's make this sustainable. Let's make this uh, to be able to build some economic gain for these communities so that they're able to lift themselves out of poverty even as they need solar solutions. Yeah.
No, it's a very, very important journey because one of the things we always say as an investor is that an entrepreneur should own it.
Sure.
Otherwise, you can't sustain the number of years
It's
you
true.
have to build the company
It's true.
to make it sustainable.
It's true.
So that's why I wanted to know a bit more about the foundation. But I'm sure you face challenges even
Yes.
then, social, etc. Tell us a bit more.
So I think one of the first challenges I faced was in my head, I had all this idea of let's help these communities. They clearly have problems. They've complained about it. So if you give them the solar solutions, it's gonna be easy peasy. Let's take it advantage. It doesn't work that way. It really just completely does not work. Just even before I go deeper into what we're building right now, Dropaccess, there's a time we're trying to introduce clean cooking technologies paired with solar technologies for these communities, and they didn't care about clean cooking. They didn't want all these fancy jikos we're distributing. They didn't want about the briquettes that we're distributing. They wanted the solar lamps to work differently. So one of the biggest challenges I faced was pushback from the community. That in my head I thought it's gonna be so easy for you to adopt this, and there was resistance even in adoption, even in terms of these clear challenges just to be addressed. And to me, that bothered me a bit and took me back a bit to rethink of really the way we solve problems is not that all that clear cut. We need to work with the communities. Work with the communities is much harder in rural communities when you're a woman and you're purporting to be bringing technologies and women don't do this. And also you want to support other women and they don't allow you to actually interact with this. So these are just some of the challenges that initially I just saw that pretty much shaped how I look at technology delivery in these communities.
But I'm sure your engineering background also helped you kind of break things down because usually, and when you were talking, I was really thinking about human-centered design,
Yep.
etc. Really building for the end user in mind.
Yep, yep.
And so maybe, what was beyond the social interaction and the
Yeah.
design of the product that may not have been a good fit for that particular community?
Yeah.
What other elements can you tell us about? Yeah.
I did understand your question, Steve.
No, so I was thinking more of using your engineering
Oh, yes,
design,
yes, yeah.
what you were looking that
Yeah.
maybe effectively made you create
Yeah, yeah.
Vaccibox.
Oh, yes, 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 yes. So, I just to inform you that creation of Vaccibox was highly human-centered design. And I always don't miss an opportunity to make people understand why Vaccibox needed to be in existence. Yes. And that is because of my own challenges as a mom, going to a healthcare facility, a clinic with my newborn daughter, and I couldn't get a vaccine. Then just trying to understand like why don't people always get vaccines when they're available. And I did a lot of data collection, pretty much interacting with the nurses, interacting with the mothers, interacting with the healthcare managers to understand like what are the true challenges that you're facing. And when I use design thinking technologies as an engineer and also just somebody who had a bit of experience in human centered design, I realized that first of all, just bringing any other quality solution into the mix just wasn't going to cut it. Yeah. These people needed a portable solution that works both for transportation as well as implicit. They needed a cold chain solution for vaccines that was able to allow them to store enough vaccines at the facility for the whole month so that they don't do back and forth each and every single week or even twice a week, going to the level 4 healthcare facility to collect vaccines in the morning, conduct vaccination, and rushing back. And they have to close the clinic while doing this. So all these challenges that they were giving into this process pretty much built to the creation of Vaccibox being a portable vaccine refrigerator. But then also, there's a time we literally went through a whole nurse journey of when they're collecting vaccine, the motorbike that they take, or the bicycle that they take, or the matatu that they take with the call box to deliver it to the healthcare facility, and the things that happen in between. And I noticed that sometimes on a motorbike or a bicycle, you get a puncture.
Yeah.
And in the middle of nowhere. So either you call for help or you have to walk back somewhere like to a market like 3 kilometers away to get the solution. And they told me that in between here, what will happen is the breakages of vaccines, the cold chain will be compromised, and they have to make a decision of either return the vaccines as fast as possible or just count it as a loss and just write it down in the books and loss. And I translated that to economic loss, but then also the healthcare burden. It means a child who is waiting to be vaccinated is not going to get the polio vaccine. It's not going to get the H. pylori vaccine. And that means they're going to be at risk of becoming sick. And even children actually got sick. So what they told us was, we like a solution that makes it seamless for us to collect vaccines on our motorbikes or our bicycles, deliver to the healthcare facilities, and must I really do the back and forth every single day? Can I just do the vaccines here? Not worry about electricity, or not worry about the integrity of the vaccine. So that's engineering on the integration of vaccines.
Excellent. I really love it. It's very good because there's one thing that you mentioned that made me really think about the whole design. So there's a question that I wanted to ask you in that whole process, and obviously I'm very interested in understanding that a bit more.
Yeah.
You know, vaccines, from what I know, they work in batches, right? So that means that in the box, that means that at some point, if you open one batch, you have to use them all, right?
Yeah.
So how did you manage that as well?
So even before I answer that, just to give you a bit of a situation of what happens in a healthcare facility. So there is a batch, and there's also a vial. So a batch has like several vials in it, and a vial has like several doses in it.
Yes.
So there is how you manage the batch and also how you manage the
The
vial.
vial.
Once you open the vial, let's say it has like 9 or 10 doses, you can't close it and say, oh, sure, I can just take one dose and use 8 tomorrow. No, it doesn't work that way. You have to use it all. So also these healthcare facilities, they had to ensure that they have 10 people to allow them to open a vial. It's much more stricter in Nairobi. In the rural communities, they allow you, if you're 5 people, you can open it. It's an acceptable dose for 5, or just like you can use 1 or 2 doses for the sake of humanity's sake. But then when I do the healthcare economics of losing 1 or 2 doses and a dose of a vaccine going for like what, $30 or something, it's such a huge economic loss. So now the biggest challenge also came into how do you protect the batches and the vials from not going into loss? And that is where again we went back to asking the healthcare workers, what do you do? What do you think will make it seamless for you to be able to monitor the batches, to be able to monitor the vials, and reduce loss as much as possible? Because each and every single dose that you save means another child gets a chance to actually receive that dose, and another life gets saved. And that is where we came up with the IUT solution. So the IT solution also didn't just stem from just protecting the batches, but also make it seamless for the nurses to be able to record and monitor the refrigerators. So when we're having the discussion about how do you protect a batch, how do you protect a vial, they're like, yeah, sure. I like to know the temperature of the fridge when I'm on the other side of the clinic. I like to know how the fridge performed overnight. I like to know how I can actually gather all this data at the end of the month to make it easy reporting. And when we sat down with them, we realized that the IoT solution has to come into play, and it had to be connected to the Vaccibox, where it records the temperatures at all times. And whenever there is like a fluctuation, it's called an excursion, there is actually an alert system that the nurse gets. And whenever the batches are, let's say, almost depleted, they're actually being alerted that the batch is almost depleted, or whenever there are several batches in the same and one has been opened and it needs its near expiry date, they actually get to be alerted that, hey, you need to use this batch. And that's what the IoT system for Vaccibox does. It's not something that Dropaccess system up and say, sure, we're going to build a fancy system because we're engineers. It's actually what the nurses told us that they wanted the ordering system and how it would be seamless for them to be able to just manage the vaccine data and the contact data.
Excellent. So it also helps in terms of procurement supply chain so that they know that they can order a new batch, etc. Excellent.
Yes. Yeah.
Wow.
Yeah. And just in addition to that, officially this year we are making it much more robust with the support of one of our partners, and we're doing a pilot in Turkana County where we want to link what's happening at the healthcare facility and what's happening at home.
Yes.
It's not 100% guaranteed that the vial is going to be useful. But if we drive demand by reminding the mothers, tell mothers like, hey, you can go to the healthcare facility on Monday and get vaccinated, then all the batches are saying the whole vial is going to be used. So with this pilot, we're actually doing a reminder system for mothers. And it's community based where your neighbor can come and remind you, like, hey, you need to take a child to be vaccinated. Yes. Because honestly, as a mom, we forget. We get busy. And the time just passes.
I think there are one or two companies that can introduce you who have the system of sending SMS messages, etc. that maybe can work with. Excellent. So we spent a lot of time really to understand Vaccibox technical thinking because that's the engineer talking. I can see that very well.
Yeah.
And so today, how many people are in Vaccibox? And one of the key questions I want to ask you is you as a woman founder, how do you manage a team?
Oh my goodness. Oh my god. So we've suddenly grown to 17 people in the core team for Dropaccess, which is like amazing and an honor. Because as a founder, when people believe in your dream, like it's the biggest honor somebody connected with you. But also as a founder, I have no idea how to manage 17 people. Like, no, so so we used to be my co-founder James and I. Then the team grew to the production team. For a very long time, we were like 5, 6 of us. It was such a nice, intimate setting. Then, mid to end of last year, the team grew to 10. And as of February this year, the team is 17. And I never knew in my life that I will stop struggling with building Vaccibox as the nurses want it, to struggling with managing a team of 17. Like, I'm not really properly built for it.
But you're already managing a team.
Yes, I am.
But what I want to say is that it's funny because we don't realize, and you say your mother, etc. You're actually managing a team already.
Yeah.
You just need to translate those skills into your business environment with different skills.
It's a different team, Steve. You're right. You're right.
Yeah. You should think about it as, okay, I need to manage not my kids, but a team of people in a different way. I agree with you.
It's true.
That we can discuss. So,
talent management. Add something to that?
Yeah, please do.
I would lie. There are times when I've clearly seen a very sharp similarity between how I manage my household and my family and how I manage Dropaccess. Especially the patient with the kids part. I just bring it to the company.
That's very, but also part of you discovering your management style.
Yeah,
and that's another element to it that we can go into briefly.
Yeah.
So, the next step of my question is really to look at the growth until now of Dropaccess.
Yeah.
And the second question is really about where do you see yourself in, I'm not going to say 5 years, but let's say like 12 months.
12 months.
Yeah.
Oh, wow. Where do you see ourselves in 12 months?
Yeah.
Obviously, we want to have a deeper scale in Kenya to be able to penetrate to way more counties. We're running around 6, 7 counties in the ASAL regions. But within 12 months, we want to change the business model for Vaccibox. We want to introduce cooling as a service. We want to go deeper into animal health, which I didn't mention that right now beyond human health, we're actually also in animal health care and the opportunities over there.
Very understandable because of planting and conservation of diets.
Yeah. But then also we want to be in other countries. So at the moment we're in Zambia, Tanzania, Cote d'Ivoire.
Oh, wow.
And we had so much approach to be in Ghana and Nigeria. And I think we want to explore how we can actually build sustainable business models in Ghana and Nigeria. We have key interests in Ghana and Nigeria, because of the population, but then also the statistics make sense, and it's right to just introduce vaccine in the market.
And Ghana, Nigeria, a lot of places in West Africa are very hot.
Yeah.
So a cooling supply chain is very, very important. Not
Yeah.
just for that, but for other products and services.
It's true.
Yeah. Excellent. So one of the things that also is interesting for people within the Tales of an African CEO is your relationship with investors.
Oh.
or lack thereof. So tell me, how's been the fundraising journey?
Oh my God, Steve. I think we need a whole.
So maybe we'll do a part two. We'll see if we do a part two about that. Yeah, maybe some highlights. I think what would be interesting is, tell us one excellent relationship with an investor.
Yeah.
And one less so interesting, obviously no names, and really to demonstrate like what kind of challenges you can face, and really can have very good experience.
Yeah.
If you want to mention the names for the good ones, yes, no problem.
Yeah.
Just maybe let leave the names of the other ones out.
Yeah, definitely. So I don't know why my mind is just raced instantly to this.
Yeah.
So I had my second child in 2023. Yes, I had my
Yes.
boy in 2023 in April. And I went on maternity leave April and May, and I had to come back to work in June before even the 3 month maternity leave was over. Because one of the investors threatened to pull funding from our organization because the lead, wasn't leave. Yes. As American business. Yeah.
Wow.
Yeah. They felt like the organization was going to lose traction, its direction, with me being away for 3 months. 3 months was way too long for them. So they pretty much gave me an ultimatum of, you need to go back to work. And that's how my leave ended.
Did they invest?
They had already invested, so it was like a rolling investment going in, and it was actually a grant investment that was supposed to be catalytic for commercial funding. And I had to go back to work because also I didn't want to lose the funding. So it was a very tricky period for me.
I must make a comment. A grant investor.
Yeah.
That's not even an investor for me.
Yeah.
It's a grant provider.
Yeah.
Forcing you as a CEO to come back from maternity leave because the person felt the company couldn't run without you.
Yep.
Wow. Okay, let's talk about the positive one then.
We've had a pretty very good investment relationship. We've actually received a lot of grants and a bit of debt. We've had very good relationship with the likes of Develop and the DG Bank. And I think to me, the reason why that has been a really super positive relationship is the understanding of things change each and every single day in a startup ecosystem. Your priorities change so fast than actually you plan them out. And they gave us that flexibility and understanding of things are going to change, but we are not going to penalize you because you didn't meet the KPIs. Just tell us what's your next step going to be. And that taught me to always communicate to other investors like, hey, things are changing a bit here. Is there a wiggle room of flexibility? And surprisingly, we've actually had good relationship with other investors who've come in on board who've understood that things actually do change, and you need that flexibility to be able to just work around so long as you meet your end impact that you intend to achieve.
Okay.
So last year was our first time raising our equity raise for the first time ever. We had like year-long discussions with so many equity investors, so many deal room meetings from 2023 to 2024. But like you mentioned, we're going to have another session when we talk about investment.
Yes, yeah.
But Steve, unfortunately, the equity conversation that we were about to close fell apart last minute.
Let's leave it up. Part two coming.